Yesterday afternoon, I received a call that deeply moved me. It was Robert, a 72-year-old man with a breaking voice. As soon as I answered the phone, he said, "Dr. Marina, I'm afraid. Feel like I'm not the same as before. I don't know what's happening to me." I listened to him for 20 minutes without interrupting. In every word, you could hear the weight of shame, loneliness, and anguish that so many men over 65 carry in silence. And when we hung up, I understood something very clearly. What was happening to Robert wasn't an isolated case. Thousands of men live with the same concern, thinking that the passing years have taken away not only their vitality, but also their right to pleasure. What Robert didn't know, and what many of my patients discover as soon as they come to my office, is that there's medical knowledge that almost nobody shares. A secret backed by modern science that can restore confidence, energy, and overall health. After more than 20 years treating men in clinical practice, I've seen life-changing stories. A few months ago, I received Michael, who is 70. He entered, slowly, head down, with that dim look I've seen in so many patients. When he finally dared to speak, he confessed shyly, "Doctor, I don't know if I should ask you this. I'm very embarrassed, but I want to know if masturbation at my age is harmful. I feel like it might affect my prostate, weaken my heart, drain my strength." At that moment, I knew I had before me the reflection of a myth that has survived entire generations. And I understood it was time to break decades of medical silence. Because the truth is exactly the opposite of what Michael feared. Masturbation in older adults doesn't destroy, but protects, strengthens, and rejuvenates. That's why today I want to speak to you, who perhaps are over 60 and have silent doubts. I want to tell you the same thing I explained to Robert, to Michael, to Philip, and to so many men who have passed through my office. Because this information could change your life, and perhaps also someone close to you. We've lived for decades surrounded by inherited myths and prejudices. Our grandfathers, our fathers, grew up in an environment where talking about pleasure was taboo, where sexuality in old age simply disappeared. But current science shows us a completely different reality. Masturbation after 65 is not an enemy, but a powerful ally to keep us healthy. What I want you to understand is that this topic goes far beyond the prostate. Conscious masturbation has an impact on your entire body. Let me tell you the story of Arthur. After prostate surgery, he suffered from urine leakage. He felt humiliated, isolated. His self-esteem was on the floor. I explained to him that each orgasm is intensive training for the pelvic floor, and that he shouldn't be ashamed to stimulate himself. 3 months later, he came back to see me smiling. He had regained control. "Dr. Marina," he told me with tears in his eyes, "I've been wearing adult diapers for 8 months, afraid to leave my house. I couldn't even play with my grandchildren because I was terrified of an accident. After following your advice, just 10 minutes of self-pleasure 3 times a week, I haven't had a single leak in 3 weeks. My wife says I stand taller. I feel like a man again." Arthur's case isn't unique. James, 68, came to me after radiation therapy for prostate cancer. The treatment had saved his life but left him with severe urinary incontinence. "I feel like a child again," he confessed, dependent on pads and afraid of every cough or sneeze. When I explained how masturbation could help strengthen his pelvic floor muscles, the same muscles that control urinary flow, he looked skeptical but desperate enough to try. 6 weeks later, James walked into my office without the characteristic shuffle of someone wearing a pad. "I've reduced my pad usage by 75%, he announced proudly. My urologist is amazed at my progress. He asked what medication I was taking, and I just smiled and said natural therapy. The benefit isn't just physical. Each orgasm releases dopamine, oxytocin, and endorphins, substances that improve mood, reduce stress, and relieve pain. Dr. Johnson from the University of Chicago confirmed in a study that sexually active older men have less depression, better sleep, and lower cardiovascular risk. But let me explain exactly what happens in your body during and after masturbation. When you reach orgasm, your brain experiences a surge of dopamine, the feel-good neurotransmitter that activates your brain's reward center. This is immediately followed by a wave of oxytocin, often called the bonding hormone, which creates feelings of well-being and relaxation. Simultaneously, your body releases endorphins, natural painkillers more powerful than morphine, that reduce physical discomfort and create a sense of euphoria. This chemical cocktail creates what researchers call a reset effect on your nervous system. For men over 60 who often deal with chronic stress, anxiety, and even depression, this natural reset can be transformative. In fact, a Harvard Medical School study found that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times per month. Chronic stress is one of the most dangerous enemies after 65, and conscious masturbation is one of the most potent and free medicines that exist. Cases like Jack's, who, after becoming a widower, felt disconnected from his body, confirm this for me. When Jack first came to see me, he was 74 and had lost his wife of 48 years just 9 months earlier. "I feel nothing anymore," he told me, "just emptiness." He had stopped taking care of himself. His shirt was wrinkled, his hair uncombed. The spark in his eyes had disappeared. I gently suggested that reconnecting with his body through conscious touch might help him reconnect with himself. "You're not just mourning your wife," I explained. "You're mourning the touch, the intimacy, the physical connection that was part of your daily life for nearly 5 decades. 2 months later, Jack returned looking like a different man, pressed, shirt, trimmed hair, and most importantly, that vital spark had returned to his eyes. "I feel alive again," he said. "I realized I had stopped living in my body. Now I've reclaimed it. I still miss my Martha terribly, but I've stopped punishing myself for being alive." By learning to touch himself consciously, he recovered not only desire but the will to live. And furthermore, conscious masturbation can save lives. Sam detected a lump in his testicle during self-exploration. Thanks to this, we diagnosed cancer in an early stage. Today, he's alive because he knew his body. Sam's story is particularly powerful. At 67, he had never been comfortable touching his genitals for pleasure or health. Growing up in a strict religious household, he'd been taught that such touching was sinful. During one of our sessions, I explained the importance of testicular self-examination and how regular masturbation naturally incorporates this health check. Initially reluctant, he eventually agreed to try. 3 weeks later, he called my office in a panic. "I found something," he said, "a small lump on my right testicle." I immediately referred him to a urologist who confirmed early-stage testicular cancer. Because it was caught so early, the treatment was minimally invasive and his prognosis was excellent. If I hadn't started touching myself, Sam told me later, I would never have found that lump until it was too late. My embarrassment nearly cost me my life. Another patient, Walter, 78, had a similar experience with a different condition. During regular self-stimulation, he noticed a change in his penile tissue, a slight hardening that hadn't been there before. This early detection of Peyronie's disease allowed for immediate treatment, preventing the severe curvature and dysfunction that often occurs when the condition progresses unnoticed. Even in a relationship, masturbation remains important. Steve asked me if it was a betrayal of his wife. I replied, "You have dinner with her, but you also eat alone. You walk with her, but you also walk alone. Your personal intimacy doesn't compete, it enriches." Steve, 72, and his wife Martha, 68, had been married for 43 years. They came to my office together, which is unusual but increasingly common as couples seek to address intimacy issues as a team. Martha had been experiencing painful intercourse due to vaginal dryness and atrophy, common menopausal changes that made traditional intercourse uncomfortable for her. We've always had a good sex life, Steve explained, but now I feel guilty every time we try because I know it hurts her. Martha nodded in agreement, adding, "And I feel guilty because I know he still has needs." I suggested that they expand their definition of intimacy, including self-pleasure, as part of their shared sexual experience. Initially, they both seemed shocked at the suggestion. At our age? Martha asked, but they were willing to try. Free. Months later, they returned with a completely different energy between them. "We've rediscovered intimacy," Martha beamed. "Sometimes we pleasure ourselves together, sometimes we help each other, sometimes we just hold each other." "The pressure is gone," Steve added. "I no longer feel like my needs are a burden to her. And strangely, I feel closer to her than I have in years." Another rarely mentioned benefit: sleep. Many older men suffer from insomnia. After orgasm, prolactin is released, a hormone that induces rest. Victor, 76, gave up sleeping pills. Thanks to this habit, Victor had been taking prescription sleep medication for nearly a decade. He complained of the side effects: morning grogginess, occasional memory lapses, and a growing tolerance that required higher doses. When I suggested masturbation as a natural sleep aid, he laughed out loud. "You're prescribing sexual pleasure as medicine. That's a prescription I can get behind." He committed to trying it every night before bed for 2 weeks. When he returned, the transformation was remarkable. "I've cut my sleep medication in half," he reported. "After orgasm, I feel a deep relaxation that no pill has ever given me. I fall asleep faster, and when I wake up, I feel clear-headed." 6 months later, Victor had completely eliminated sleep medications from his routine. His neurologist was amazed at the improvement in his cognitive tests, a benefit Victor attributed to both better sleep and the neurological benefits of regular sexual activity. And remember, your brain is your most powerful sexual organ. If you leave it without stimulation, desire, atrophies like an abandoned path in the forest. The neurological benefits of sexual activity in older men cannot be overstated. Dr. Paulina Rodriguez, a neurologist specializing in aging, explains it this way: "Sexual arousal and orgasm create new neural pathways and strengthen existing ones. It's essentially exercise for the brain. It's particularly in regions associated with pleasure, memory, and emotional regulation." Her research has shown that men over 65 who maintain regular sexual activity, including masturbation, have better cognitive function, improved memory, and lower rates of dementia compared to their non-sexually active peers. Thomas, 81, a retired professor, came to me concerned about his cognitive decline. "I'm forgetting names, losing my train of thought mid-sentence. My doctor says it's just age, but I'm terrified it's the beginning of dementia." Among other interventions, I suggested regular masturbation as part of a brain health regimen. At our follow-up 3 months later, Thomas reported not only improved mood and energy, but better cognitive function. "My bridge partners have noticed I'm sharper," he said. "I can remember card sequences better. And my vocabulary seems to be coming back. Words I couldn't recall are now accessible again." While masturbation alone isn't a cure for cognitive decline, the evidence suggests it plays a significant role in maintaining brain health, especially when combined with other healthy habits. One of the cases that marked me most was Richard, 71, who told me, "I don't feel anything anymore. Doctor, I think it's over." I asked him for 5 minutes of conscious self-exploration daily. 3 weeks later, he returned happy. The fire came back. I felt like a man again. Richard's story goes deeper than that brief exchange. As a retired military officer, he had always defined himself by his strength and control. When erectile dysfunction began in his late 60s, he interpreted it as a fundamental failure of his manhood. Rather than seeking help, he withdrew from all intimate contact, even non-sexual touch. "I stopped hugging my grandchildren," he confessed. I felt like less of a man, like I was somehow contaminated by weakness. When I suggested conscious masturbation, focusing on sensation rather than performance, he initially resisted. "What's the point if I can't get fully hard?" he asked. I explained that pleasure exists on a spectrum. That sexual enjoyment doesn't require a full erection, and that reconnecting with his body was the first step toward healing. Reluctantly, he agreed to try the 5-minute daily practice. The transformation went beyond sexual function. At our follow-up appointment, Richard sat differently, more open, more relaxed. "I started feeling things again," he explained. "Not just sexually. I found myself appreciating music more deeply, enjoying food more fully. It's like my entire sensory system came back online." He paused, then added something profound. "I realized I've been living from the neck up for years. Now I'm back in my body." Because conscious masturbation isn't just a physical act, it's an act of self-love. It's remembering that you deserve pleasure and care regardless of your age. Edward, 74, confessed to me, "Doctor, you gave me back my life. I walk differently. I talk differently. I feel differently." Edward came to me after his wife of 52 years passed away. As a devoted husband, he had defined himself primarily through his role as a partner and caretaker. After her death, he found himself not only grieving his wife, but also facing an identity crisis. "I don't know who I am without her," he said during our first session. His physical health was declining rapidly, blood pressure rising, weight dropping, chronic pain intensifying. When I suggested that reconnecting with his body through self-pleasure might help him reconnect with himself as an individual, he was initially offended. "That seems disrespectful to her memory," he said. "On the contrary," I replied, "it's honoring the body and life you still have, the body and life she would want you to care for." 3 months later, Edward's transformation was remarkable. He had joined a senior hiking club, started cooking for himself, and reported feeling at home in my body for the first time in years. "I realized something profound," he told me. "In all those years of caring for my wife through her illness, I had forgotten that I also deserve care, even if that care now has to come from myself." And this happens because we're not talking about a mechanical act, but an intimate ritual with yourself. The ideal frequency doesn't exist. What matters isn't how many times, but how you do it. Edmund, who got frustrated for taking longer too. Get excited, learn to enjoy the slowness, and discover deeper orgasms than in his youth. Edmund, 69, came to me complaining that masturbation wasn't working anymore. "It takes forever to get hard, and sometimes I lose my erection before finishing. It's frustrating and humiliating." I explained that the physical changes he was experiencing were normal, but his expectations were based on his younger self. "Your body isn't broken," I told him. "It's just changing. Instead of fighting against these changes, try working with them." I suggested he approach self-pleasure as a mindfulness practice rather than a race to orgasm. "Spend at least 30 minutes, I advised. "Use lubricant. Focus on the journey, not the destination." 2 months later, Edmund returned with an entirely different perspective. "I've discovered sensations I never knew existed," he reported. "When I was younger, everything was focused on the end goal. Now I'm experiencing pleasure throughout my entire body." He described how slowing down had allowed him to discover erogenous zones he'd never explored before. His nipples, the insides of his thighs, the sensitive skin of his lower abdomen. The orgasms, when they come, are actually more intense and full body than they were in my 20s. They're less frequent but far more satisfying. This experience is backed by research from sexual health specialists who note that while aging does change sexual response, it can actually enhance certain aspects of pleasure when approached with mindfulness and acceptance. And if one day you don't reach climax, it's okay. The value is in the process, in the connection. That said, conscious masturbation doesn't replace medical checkups. It's a complement. Get your prostate, heart, blood exams. Together, pleasure and medicine, they form a comprehensive shield for your health. George experienced it this way. I didn't just improve sexually. I sleep better. I'm happier. My family notices the difference. George, 77, came to me with a list of complaints typical of men his age: joint pain, fatigue, mood swings, and declining interest in activities he once enjoyed. His medical tests showed nothing alarming, just the expected changes of aging. When I suggested adding conscious masturbation to his self-care routine, he was skeptical but willing to try. At this point, I'll try anything that might help, he said. 6 weeks later, the changes were evident before he said a word. He walked into my office with more energy, better posture, and a smile that had been absent in our previous meetings. My daughter asked if I was on new medication. He laughed. My son-in-law said I seem years younger. The benefits extended far beyond sexual function. George reported that his persistent shoulder pain had decreased, his sleep had improved dramatically, and his mood was more stable. I feel like I have a secret weapon against aging, he said. The science supports George's experience. Regular sexual activity has been linked to increased production of immunoglobulin A, which boosts immune function. The hormonal benefits, including balanced testosterone levels, support joint health, energy, and muscle maintenance. And the psychological benefits of pleasure and bodily autonomy create resilience against depression and anxiety, which often accompany aging. Sexuality doesn't end at 65. It never ends. The hardest part isn't explaining the medical aspect, but breaking prejudices. Many patients ask me, "What will my children say?" Or, "Isn't it betrayal to my wife?" I tell them, it's not betrayal, it's not shame, it's self-care. William, 68, struggled with this question after beginning a new relationship 2 years after his wife's death. My adult children seem uncomfortable with the idea that I still have sexual needs, he confided. My son actually said it was inappropriate at my age. This attitude reflects a common but harmful stereotype that sexuality in older adults is somehow unseemly or unnatural. I encouraged William to have an honest conversation with his children, focusing on the health benefits rather than the intimate details. You wouldn't feel guilty about taking heart medication, I pointed out. Sexual health is just another aspect of overall health. Eventually, William found a way to assert his rights to pleasure and intimacy while respecting his children's adjustment period. They don't need to know everything, he told me later, but they do need to know that my life isn't over, and neither is my need for physical connection. Society wants to convince us that pleasure in old age doesn't matter. It's a cruel lie. Emilio, 79, summed it up like this. "Doctor, you taught me that aging doesn't mean dying while alive. Today, I feel more alive than at 60. Emilio's journey was particularly moving. A former marathon runner, he had defined himself by his physical prowess throughout his life. When age and arthritis made running impossible, he fell into a deep depression. "Without my morning run, I felt lifeless," he explained during our first meeting. When I suggested redirecting his physical focus toward sexual self-care, he was initially dismissive. "That's not the same thing at all," he insisted. "Both involve endorphins, physical exertion, and a mind-body connection," I countered. "Both can be practiced mindfully, with attention to breath and sensation." Reluctantly, he agreed to try a 15-minute self-pleasure routine 3 times a week. At our follow-up appointment, his perspective had shifted dramatically. "It gives me something similar to the runner's high," he admitted. "That same feeling of being fully present in my body, fully alive." Over time, Emilio developed what he called his sexual wellness routine, a combination of stretching, mindful self-pleasure, and relaxation techniques that gave him back the physical joy he thought he'd lost forever. And here I must warn, there are mistakes that can nullify the benefits. I've seen men hurt themselves through rough practices, ignore medical checkups, or think that masturbation replaces everything else. That's not correct. One common mistake is approaching self-pleasure with the same intensity and vigor as in youth. Alan, 73, came to me with inflammation and small tears in his penile tissue. "I don't understand what's happening," he said. "I'm doing everything the same way I always have." That was precisely the problem. I explained that aging skin and tissues require more gentle stimulation and abundant lubrication. The blood vessels become more delicate, and healing takes longer when injuries occur. Another mistake is ignoring pain or unusual symptoms. Charles, 66, noticed a burning sensation after ejaculation but dismissed it as just part of getting older. When he finally sought medical attention, he had developed a serious infection that required extensive treatment. A third critical error is using masturbation as a substitute for medical care. Martin, 70, was using self-pleasure to manage his prostate symptoms instead of getting proper treatment for an enlarged prostate. While sexual activity can help prostate health, it doesn't replace necessary medical interventions. That's why I'm preparing a special video with the 10 most common mistakes you should avoid. 'Cause the practice is medicine, but it requires awareness and care. Meanwhile, remember this. Michael recovered intimacy with his wife. Robert celebrated a second honeymoon. Ernest feels like he's 50 at 75. They all decided not to resign themselves. And you, what will you decide? Conscious masturbation after 60 isn't a matter of morbidity, it's a health issue. Your prostate, your heart, your mind, your self-esteem, all benefit. Let's talk specifically about these benefits in greater detail. For your prostate, regular ejaculation helps flush out potential carcinogens and reduce inflammation. The Journal of the American Medical Association published a study following 29,342 men over 18 years, finding that those with higher ejaculation frequency had significantly lower rates of prostate cancer. The protective effect was strongest for men over 60. For your cardiovascular system, sexual activity, including masturbation, is a form of exercise that increases heart rate, improves blood flow, and lowers blood pressure. Dr. Joseph Goldstein, cardiologist at Mount Sinai Hospital, explains, the cardiovascular exertion during masturbation to orgasm is roughly equivalent to climbing 2 flights of stairs. For older men, this regular, low-impact exercise helps maintain cardiovascular health without the joint stress of more intense activities. For your immune system, regular sexual activity boosts production of immunoglobulin A and natural killer cells, your body's first line of defense against pathogens. A study from Wilkes University found that people who had regular sexual activity 1 to 2 times per week had 30% higher levels of certain antibodies compared to those who were less sexually active. For your mental health, the neurochemical benefits are profound. Beyond the immediate pleasure, regular sexual activity is associated with reduced rates of depression and anxiety in older adults. The release of oxytocin, often called the bonding hormone, creates feelings of well-being and contentment that can last for hours after sexual activity. For your cognitive function, sexual arousal increases blood flow to the brain and triggers the release of DHEA, a hormone that improves brain function and may help prevent Alzheimer's disease. Studies from the University of Manchester found that sexually active seniors performed better on cognitive tests than their non-sexually active peers. Remember, your brain is the engine of your desire. Keep that circuit alive. Stimulate your mind and your body will continue responding. Leo, 77, believed everything was over. 2 months of conscious self-exploration made him recover not only his desire, but his will to live. Today he sings, laughs, and plays with his grandchildren like he hadn't done in years. Leo's story illustrates how sexual health impacts overall vitality. When we first met, he was taking 7 different medications and had resigned himself to a life of progressive decline. "My days of feeling good are behind me," he said flatly. His medical history revealed no major issues, just the accumulated effects of aging, inactivity, and loss of purpose after retirement. When I suggested that reconnecting with his sexual self might help reconnect him with his vital energy, he seemed doubtful but willing to try. The changes began gradually. First, he reported sleeping better. Then his chronic digestive issues improved. By our third follow-up appointment, he had worked with his doctor to reduce his medications from 7 to 4. "I have energy again," he marveled. "Not just for sex, for everything." Leo's experience reflects what researchers call the cascade. Effective sexual well-being, how improvements in this one area tend to flow into all aspects of health and life satisfaction. Henry strengthened his marriage by reconnecting with himself. Sam saved his life by detecting a lump in time. Victor sleeps like a baby without pills. All these testimonials confirm the same thing. Conscious masturbation is comprehensive self-care. And I want this to be clear. It doesn't replace medical checkups. It doesn't replace healthy habits. It's a complement, a natural medicine that's in your hands. Your sexuality isn't a luxury. It's not a whim. It's a health necessity and a human, right? The World Health Organization has officially recognized sexual health as a fundamental aspect of overall health at every age. Their position statement affirms sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. This recognition is crucial because it validates what many of my patients discover. Maintaining sexual health in their later years isn't just about physical pleasure. It's about maintaining dignity, autonomy, and well-being in all dimensions of life. Caging doesn't mean giving up. It means learning new ways to enjoy, to care for the body, and to live with awareness. I'm Dr. Marina, and I hope these words restore the confidence, energy, and joy you deserve. The decision is in your hands. Your years don't extinguish your desire, they transform it. They don't extinguish your strength, they reinvent it. Your body is ready. It's just waiting for you to decide to listen to it again.